বিসমিল্লাহির রহমানির রহিম। আজকের লেকচারের পার্ট 2 অংশে আমরা তিনটা প্রসঙ্গ, তিনটা বিষয়ে হসপিটাল ফার্মেসি প্র্যাকটিসে তিনটা প্রসঙ্গে আমরা আলোচনা করব এই অংশে। তার মধ্যে এক নম্বর হচ্ছে ড্রাগ ইনফরমেশন সার্ভিসেসের স্ট্যান্ডার্ড অ্যাজ সাজেস্টেড by the Manitoba Pharmaceutical Association, the standards that are to be practiced during the delivery of the drug information services. একটা এই বিষয়ে আলোচনা করব, স্ট্যান্ডার্ডগুলি আমরা দেখব। তারপরে আমরা আলোচনা করব এক্সটেম্পোরেনিয়াস কম্পাউন্ডিং এর জন্য যে স্ট্যান্ডার্ডসগুলি ডিক্লেয়ার করেছে সেই বিষয়গুলি আমরা আলোচনা করব। তারপর আমরা আলোচনা করব মেডিকেশন এরর অ্যান্ড ইভেন্টস যেগুলি হসপিটালে সাধারণত হলে পরে সেটার জন্য যে স্ট্যান্ডার্ডগুলি আছে সেই স্ট্যান্ডার্ডগুলি আমরা আলোচনা করব। আমরা প্রথমে শুরু করছি আজকের যে ড্রাগ ইনফরমেশন সার্ভিসেসের স্ট্যান্ডার্ডসগুলি। আমরা বাই দিস টাইম আমরা বুঝেছি উই আর ফলোয়িং রিডিং অ্যান্ড গেটিং টু আন্ডারস্ট্যান্ড অ্যান্ড টু extract the standards that are set by the Manitoba Pharmaceutical Association on different issues of hospital pharmacy practices. Now I am placing to you the standards of the Drug Information Service. The standard for Drug Information Service, as stated by the Manitoba Pharmaceutical Association, is that a pharmacist shall provide accurate, unbiased, pertinent drug information. We understand this is the standard, and in the interpretation of this standard, the Manitoba has stated in their literature, the standards to practice are, as the interpretation is that to practice in the hospital. Number one, the pharmacist department must have the minimum text as determined by council. We understand whenever we studied the pharmacy law of Florida, at that time we mentioned that the council usually declares the standard textbook, reference book, etc. Whenever we are delivering in the drug information services, the pharmacy department should have in their possession the standard text as decided, as stated by the council of Manitoba. This is the literature for Manitoba. So we are telling the Council of Manitoba whatever they suggest that the texts that are to be used whenever we are delivering the drug information services, those minimum textbooks, references are to be kept in the pharmacy. Number two, all drug information requests must be handled by a pharmacist. All sort of drug information request, whatever is asked for from any area of the hospital, must be handled by the pharmacist of the drug information center, or a student or intern under the direct supervision of a licensed pharmacist. We understand it. All requests is to be handled by pharmacist. Number three, the pharmacist shall select the current drug literature, those reference sources which will meet the drug information needs of this specific area of practice. The pharmacist will select the drug information literature from which the information will be provided from the pharmacist who is in the drug information center. He will select the current drug literature from the text. Number four, the pharmacist shall evaluate and analyze relevant drug and therapeutic information contained in the correct drug literature. The pharmacist responsible and working in the drug information center will select and evaluate and analyze the relevant drug and therapeutic information of the current literature. Then a system of classification and organization shall be developed to enable rapid retrieval of the information. There should be in the pharmacy department, should be some system developed so that the classification and other information and organization of these literature contents is to be developed by the pharmacy department. A readily accessible filing system supported by the cross-index file should be maintained in the pharmacy department. Then the pharmacist shall use professional expertise and judgment in processing drug information requests. Whenever the pharmacist is providing the drug information, at that time pharmacist will use his professional expertise and his judgment regarding these items. Number one, obtaining the necessary background information so that the request is received in a complete and understandable form. We understand that the pharmacist who is receiving the request, at that time he should be making necessary background information on the request. What sort of information the seeker is asking for, it is to be carefully obtain the background information, for what purpose this information will be required. Then number B is that interpreting the drug information request, and he would understand what sort of information is to be provided, and he will interpret it carefully so that all information that is required or that is asked for is to be written, is to be supplied to the seeker. Number C, systematically and thoroughly conducting the literature search. Then the pharmacist will of the Drug Information Center will search the relevant information and current information from the literature source. Then D, evaluating the literature in an accurate and unbiased manner. Whenever the pharmacist is evaluating the literature, at that time he will make it in such a way so that the information whatever is provided, that is currently will stand as the accurate and unbiased information. Number E is that these are all standards as set by the Manitoba Pharmaceutical Association as well as the Manitoba Pharmacy Council. And then E is that formulating a relevant, coherent and informative response. Whenever the Drug Information Center is writing the information, that should be relevant to their request and coherent. That means it is compatible. Whenever the information whatever is provided, it is in such a way that it will be coherent, as we mentioned, that is compatible with the request and information source. Then F is that communicating the response in a verbal or written form. Whenever the pharmacist is providing information, he will be communicating the drug information request in a verbal or written form. Then number 5, the pharmacist should contribute the pharmacist should contribute to the drug literature. The pharmacist will contribute to the drug literature. They will be contributing as the drug information service provider. Then number 6, the Drug Information Service shall provide current information on the assessment, management, and prevention of drug poisoning in conjunction with or in absence of the poison control center. Whenever the pharmacy department is providing any information on the management and prevention of drug poisoning, at that time the pharmacy department will be checking with the poison control center responsibilities and all these things. I read it again. The Drug Information Service shall provide current information on the assessment, management, and prevention of drug poisoning. We understand this department, Drug Information Service Department, will be checking the drug information so that it is accurate, and the poison is how to assess the poisoning situation, and how to do the management of the poisoning condition, and how to prevent the drug poisoning. Then number 7, the pharmacist shall be aware of more extensive sources of information and procedures necessary to access them. The pharmacy department of the hospital, they will be in their section, in their unit of drug information service unit, they will be making the pharmacist who is working shall be aware of more extensive external sources of information and drug information services they will be doing, so which they can act, and they can check for their necessary purposes. The external sources of information, they're nationally available in another hospital or other area of the hospital. Then the drug information services shall be available 24 hours a day, 7 days a week. If staffing is not feasible after regular working hours, drug information shall be provided by a pharmacist on call. Where the pharmacy service is provided by only one pharmacist, and if it is necessary for that pharmacist's absence, the pharmacist must make arrangements in advance for the provision of the drug information services. We understand in hospital pharmacy practice, whenever we are providing the drug information services, that is to be provided 24 hours a day, 7 days in a week. In regular time, if there is shortage of pharmacists working in the drug information center, at that time we will make arrangement so that the necessary information can be provided in the pharmacist's absence. The information is made by the pharmacy department and the responsible pharmacist, and so that he will make some arrangement so that the drug information that is developed is to be provided in his absence at any time rather after the regular working hours. The pharmacist should contribute to the education of the healthcare personnel. The pharmacist of the drug information center should contribute to the education of healthcare personnel. We understand these are the national standard of Manitoba regarding the drug information services from the hospital pharmacy. Now I will produce to you the standards as they declare in the Manitoba by the Manitoba Pharmaceutical Association for the hospital pharmacy practice standards, as they mention. In this section, now I will place to you the standards that are set for the extemporaneous compounding. In Manitoba state, whatever the standard that is mentioned is that A pharmacist shall be responsible for all extemporaneous compounding, which shall be done according to established procedures and legal requirements. This is the standard. I read again. A pharmacist shall be responsible for all extemporaneous compounding, which shall be done according to the established procedures and legal requirements. This is the standard. And to this standard, the interpretations is mentioned. Whatever is mentioned is like this. I will be stating, and throughout the whole part of the interpretation, I see that they make significant importance to the parenteral nutrition extemporaneous preparations, whatever the standards that will be needed. They mentioned it in this way. Other things regarding other things, extemporaneous preparation is not mentioned here. So it will be containing other admixturing things also will be coming in it. Whenever we will discuss, we will carefully observe it. Then number one interpretation is that a parenteral nutrition, that means PN, abbreviation PN committee, should be formed with representatives from the departments of medicine, surgery, pharmacy, nursing, and dietary. That means whenever they are making this parenteral preparation, extemporaneous parenteral nutrition preparations, at that time to look after all the matters, the committee in the hospital is to be fixed, that for the parenteral nutrition committee, that means PN committee, we'll say PN committee. The committee shall develop standardized protocols for number A. They will develop standardized protocols, the way the things are to be done by during the extemporaneous compounding. The education of hospital personnel involved in PN therapy. We understand they will be educating the hospital personnel who will be involved in the PN therapy. This PN committee of the hospital will educate, will take part in education for the hospital personnel involved in PN therapy. Number B, the indication for PN therapy, in which situation this PN therapy will be done, that they will be fixing it, this committee. And number C, the ordering of PN therapy, how the ordering will be done, the formulation, preparation and administration of PN solutions. Then E is that the monitoring of patient receiving PN therapy. That means these are all the activities that will be done by the parenteral nutrition committee of the hospital. 5 things are declared in it. Then number 2, the pharmacist shall evaluate the PN order for the following. Number A, appropriate route and rate of administration. Then number B, appropriate solution and dosage of constituents. These things are clear, so no explanation is required. And number 3, C is that stability and compatibility of the constituents. These are the pharmacist who will be working for the extemporaneous compounding orders of the PN, parenteral nutrition orders. Then the pharmacist will be doing these 3 responsibilities: appropriate route and rate of administration of the PN, then appropriate solution and dosage of the constituents, and stability of and compatibility of the constituents. Any potential problems encountered shall be communicated to the physician and resolved prior to the preparation of the PN solution. Yeah, we understand it whenever they check any sort of recipe for the PN preparation is there is any problem of compatibility, then the potential problems will be discussed by the pharmacist, responsible pharmacist, with the physician before preparing the PN solution. Number 3, parenteral nutrition solutions and the solutions involved in the preparations thereof shall be stored under proper conditions of sanitation, temperature, light, and humidity. We understand it. And then the stability ground. This is the thing that the sanitation, temperature, light, and humidity should be properly maintained. Number 4, the preparation of PN solution shall be performed in a clean air environment to prevent contamination with microorganism and particulate matter. The minimum requirements shall be use of laminar airflow hood equipped with high efficiency particulate air HEPA filter. That means the PN preparations will be done in the clean area. That means aseptic room environment or environment, so that no contamination with the microorganism and dust particles happen to the PN preparation. Number 5, the pharmacist will be responsible for assuring the dosage calculation are correct for all PN orders. Whenever the preparations are prepared and delivered, pharmacist responsible for extemporaneous preparation will assure that the dosage correction for the PN preparation is accurate. That pharmacist will be responsible. And number 6, all personnel involved with PN service shall be trained in the proper procedure of aseptic technique. All of the PN service who is providing the personnel, they will be trained on the procedure of the aseptic technique for the PN preparation. Number 7, all completed PN solutions shall be inspected for particulate matter before they are dispensed for administration to patients. We understand whenever the preparation is done, so that no particle suspended particle is available in the PN preparation in the particulate form, the particle form. Then number 8, there shall be a uniform standard of labeling for PN solutions. The following information shall be included on the label. We understand whenever we are preparing the PN preparation in the hospital, as Benito was said, this should be consistent. Information should come on the labeling. A patient name and location, that means which area, which bed, which ward. B, type of base solution. What is the base? Is it water or added something other with it? Then the base for the PN preparation is to be, we understand it, the base. Then on which the ingredients are mixed. Usually universal base is water, so we mention it. It is to be mentioned. This is done on the water. Which sort of water, that is to be mentioned also. Then number C, name and amount of each additive. D, route of administration, central or peripheral route. The preparation, PN preparation, whatever is prepared at that time on the level, it is to be mentioned whether it can be given in the central route or the peripheral route. Date of preparation, then F is expiration date and time. Then number 9, all completed PN solutions and PN-based solutions prepared by technical personnel shall be checked by the pharmacist to ensure number A, correct additives and quantity of additives have been added to the appropriate intravenous solution or PN-based solution. Whenever we are making it, all additives should be correctly added in quantity and quality. Number B, the appropriate information has been included on the label. Appropriate information that is needed for the use of the PN preparation is to be placed on the label. And number C, the correct label has been affixed to the completed PN solution and PN based solution. Whenever the PN parenteral nutrition solution is made or PN base is made, at that time appropriate and correct information, correct level is to be affixed on the solution bottle. Number 10, the pharmacist shall monitor patients and their PN therapy for the detection of any problems related to the therapy. Any such problems shall be communicated to the physician. The pharmacist, extemporaneous preparation pharmacist who is preparing it at that time, whenever it is done for the administration purpose, at that time the pharmacist will monitor the patient and the PN solution, and if they detect any sort of problem, then the pharmacist extemporaneous who work for the extemporaneous PN preparation, they will discuss with the physician regarding the matter or any sort of matter, whatever happened to the PN preparation. Number 11, the quality assurance program shall include appropriate sterility testing to evaluate the efficiency of the laminar airflow hood and performance of aseptic technique. Quality control testing shall be periodically conducted to monitor established procedures for the preparation of the PN solutions for possible in-process microbial contamination. Here in this statement it is mentioned that quality assurance program, there should be quality assurance program for checking the sterility testing, so that the whatever the laminar airflow hood is or the performance is done, the aseptic technique, whether it is working without any sort of sterility failures. This quality program is to be done, and quality control testing should be periodically conducted to monitor established procedures of the preparation for the PN solution. These are all stated in the standards as set by the Manitoba Pharmaceutical Association for the extemporaneous compounding of the PN preparation, pharmaceutical parenteral nutrition preparations. Now I will read and discuss the standards of the Manitoba Pharmaceutical Association regarding the hospital pharmacy practices. In this moment I will discuss on the medication errors that could happen in the hospital pharmacy practice or in the hospital. The standard as set is that a pharmacist should expeditiously correct and properly document all dispensing errors, incidents and discrepancies. This is the standard. I read again. A pharmacist shall expeditiously correct and proper document all dispensing errors, incidents, and discrepancies. We understand expeditiously, that means sincerely and swiftly. They are expeditiously মানে হচ্ছে এটা দুইটা করতে হবে, সিনসিয়ারিটি থাকতে হবে, আর সাথে সাথে সুইফটলি ইনস্ট্যান্টলি কাজগুলি করতে হবে। সেই হিসেবে বলা হচ্ছে the pharmacist shall expeditiously correct and properly document all dispensing errors, incidents, and discrepancies. এটার স্ট্যান্ডার্ডের ইন্টারপ্রিটেশন, it is mentioned two terms are used for the medication errors. One is called medication incident, and the another one is medication discrepancy. Medication incidents, that means patient health potentially compromised. Whenever any sort of medication has error occur, it occurred to the patient. Erroneous medication commission and omission that has been subjected upon a patient. Whenever we call any medication incident happen, that means the medication error occurred to the patient after using the medication, after using the medicine to the patient. Another one is called another term that is called medication discrepancy. In this case, patient health not compromised. That means any sort of erroneous medication commission or omission has not released for the patient. It didn't occur to the patient before the administration or administering the drug. If any sort of medication discrepancy, the wrong medication occur, that is called medication discrepancy. That means the health of the patient is not in danger. That means the drug is not administered. Whenever in any medication incident, whenever the term is said, it means that the patient is under any sort of error of the medication. So for this purpose, whatever the standards are cited, there is the interpretation from the Manitoba Pharmaceutical Association regarding the medication incident and the medication discrepancy are like this. When a medication incident or discrepancy is discovered, the following as appropriate shall be notified as soon as possible to the head or charge of the nurse, attending physician, pharmacy department. Any sort of medication incident or discrepancy happened in the hospital, it is to be reported immediately, appropriately to the head of the nursing department, the attending physician who is working over there, and the pharmacy department is to be reported immediately. Number 2, arrangements are to be made to immediately correct any medication incident. Immediately arrangements are to be made if poisoning happened or whatever happened in the incident, medication incidents, or the discrepancies. Regarding we are speaking on the medication incident. At that time, arrangements are to be made immediately to correct the medication incident. And then number 3, all medication incidents and discrepancies shall be examined and reported. Whatever the medication discrepancies or whatever the medication incidents occur, in the incidents, that means it is happened to the patient, and discrepancies before administration of the medication in the formulation or in the preparation, whatever sort of error occur, that is called discrepancy. And if it is if the error happen to the preparation that is administered to the patient, that is a medication incident. All medication incidents or discrepancies shall be examined in the hospital and is to be reported. Number 4, the person responsible for the incident or discrepancy is required to complete a medication incident or discrepancy report as soon as possible after the discovery of the same. Whenever any sort of a medication incident or medication discrepancy happen, that the person who has done responsible for that incident or the discrepancy is to report. He is to report a complete report on the medication incident and the discrepancy. If that person is not on duty, the person who discovers the incident or discrepancy shall complete the report. This is like that mentioned in the standard. Interpretation to the standard. Then number 5, the reporting procedure shall be developed as a policy of the institution. That means the hospital will make a procedure of reporting the medication incident or discrepancies. A multidisciplinary committee shall be established to review all medication incident and discrepancy reports. Understand, multidisciplinary, that is from the doctor, from the nurses, from the pharmacists, and the hospital administration. There will be a committee to review all sort of medication incident or medication discrepancy reports. They will check it. And number 6, the resulting information from the medication incident or discrepancy review shall be used as an educational tool with the ultimate objective of enhanced accuracy and patient safety as it related to drug therapy. That means whenever the information whatever is prepared by the review committee, that will be delivered that will be delivered as the educational tool, so that such sort of medication incident and discrepancy do not occur to patients or do not happen if the discrepancy do not happen in the hospital. So that this is the information, this sort of information, whatever the review committee, multidisciplinary review committee of the medication incident and medication discrepancy, whatever they report, that will be delivered in the hospital as the educational tool, so that in future such sort of incident and discrepancy do not occur in the hospital for whenever the medication work is done at that time. Enhanced accuracy and patient safety is established in the hospital. These are all we checked from the standard practices, hospital pharmacy practices as suggested by Manitoba. And regarding there are guidelines whenever we will seek any sort of guidelines for the hospital pharmacy practices, whatever we cited here. It is available on the literature, on the literature from pharmaceutical Manitoba Pharmaceutical Association as the guidelines on practice of hospital pharmacy, and we have, whenever we cited, discussed many matters related to it in our hospital pharmacy as well as pharmacy practice during whenever we conducted the courses. If any one of you will require any sort of guidelines regarding the distribution standards, to keep distribution standards in the hospital, or drug information, if you need any sort of guidelines, you check it from the internet with the keywords like this: Manitoba Pharmaceutical Association guidelines on for practice of hospital pharmacy. You'll get all the guidelines. And thank you all for listening me on the as an example for the hospital pharmacy practices standards. We checked the literature of the Manitoba Pharmaceutical Association. Thank you for listening.